Okay, we're doing part 12 of this book, Prevent and Reverse Stroke and Heart Attack by me, Pete Rogers. If you're following along in the book, we're on page 92, figure 4-7. And this is a real important picture. If you're really interested in learning about stroke, we're going to talk about the most common cause of stroke today. You might want to hit the print screen button and keep a copy of this picture, okay? So I made the drawing to explain how it works. Basically, where the skull and crossbones is located, that's the most common spot people have a stroke. I can see in one day hundreds of strokes in this location. Okay, these are sometimes often called silent strokes. These strokes are typically in what's called the deep white matter. At the level of the lateral ventricles, these are the lateral ventricles drawn in blue for cerebral spinal fluid, that's what they contain. They're called the corona radiata. Just below the lateral ventricles, it's called the basal ganglia because that's where there's a lot of cell bodies deep in the bottom of the brain, the basal part of the brain. And then above these lateral ventricles, it's called the centrum semiovale, the central white matter, because it's in the center and it's semi-oval in shape when you look at it in a cross section. Okay, well anyways, the deep white matter, or the centrum semiovale and corona radiata, is where most people get stroke. And the reason they get stroke is because they're damned if they do and they're damned if they don't. Once you got hypertension, you're half screwed. Okay, so if you got hypertension, you want to fix it as best you can by optimizing your diet and lifestyle. Okay, get your sleep, avoid caffeine. Okay, manage your stress. And here's why. If the hypertension goes uncontrolled, you'll keep on just damaging the arteries from the hypertension. You'll get atherosclerosis, and that can lead to tissue ischemia. Let me actually show you a quick picture of that so that'll make more sense. When you got hypertension, you get thickening of the arterial wall. So here's a normal capillary. All right, the yellow line is the capillary basement membrane. These red cells here, the red blood cells, carry oxygen and the hemoglobin. The blue circles are the oxygen being delivered to a nerve cell. An axon is the elongated part of the neuron, tubular part of the neuron. The cell body is where the nucleus is with the DNA. Okay, so these red blood cells travel through a capillary, and then they release their oxygen, which has to pass across the capillary basement membrane, also across the vascular smooth muscle of the cells that encircle the capillary, or the pericytes, you can call them, in the brain, and the astrocyte foot processes and whatnot. Okay, so anyways, that oxygen has to travel from the capillary to the neuron. Well, if you have hypertension, you'll get hypertrophy of these vascular smooth muscles. With diabetes, you'll get hypertrophy of this capillary basement membrane. You'll get hypertrophy of the connective tissue around there, so you're going to increase the distance, and you're going to make it more difficult for the oxygen to be delivered to the axon. Plus, if the red blood cells are all stuck together by fat, you're going to drop the oxygen delivery about 15-20%. So all of these things cause less oxygen delivery to the neurons and increase the risk that the neuron's going to die due to a lack of oxygen delivery. Okay? So what I'm saying is chronic hypertension makes this worse. So if you don't treat the hypertension at all, it's going to keep getting worse. And if you do treat it, there's a new issue. I'll go back to that last drawing and I'll show you. It'll make more sense. Okay, going back up to the drawing. This is the internal carotid artery. It goes up into the brain. You can remember the carotid as being like your thumb. Stick your thumb under your jaw. That's your internal carotid. It goes up deep into the center of the brain. And then your fingers are the external carotid artery branches that just go to your face. There's no branches of the internal carotid artery in the neck. So it comes right up into the brain. It has an anterior cerebral artery, which I'm not going to show because the drawing would be too complicated, but the important one to know about is the middle cerebral artery. It extends outward through the basal ganglia, actually Sylvian fissure between the frontal lobe and the temporal lobe, and then it exits along the convexity of the brain. The convexity of the brain is called convexity because just like your skull, it's convex outward. And then it has these penetrating arteries that go into the parenchyma, the pulp of the tissue, to perfuse it, to deliver oxygen and glucose to the tissue. And the hardest spot to supply is where the skull and crossbones is. If there's atherosclerosis due to hypertension and diabetes in these arteries, they have a hard time getting blood up to the skull and crossbones. If there's atherosclerosis in these arteries and these other arteries out here, all the stuff I just talked about with regard to hypertension and diabetes and atherosclerosis, it's hard for them to get enough oxygen and glucose blood supply to this area. So this is where I see tons of strokes. And you understand what I meant by damned if you do, damned if you don't? If you don't treat it, the hypertension damages the arteries and you get atherosclerosis and a drop in blood flow. If you overtreat it too much, you drop the blood supply down, the blood flow down, and you don't perfuse this area. Okay, that's why I can see some patients will have 10, 20, 30, 40, 50, 60, 70 strokes in this area. Little tiny strokes, and they just keep on dropping in their cognitive function, getting mentally slower and slower, physically slower, walking with a walker, eventually motor scooter, cognitively impaired, demented, dead. Okay? I see that every day, many times. Okay? That's why all these people say, well, what about some rare disease? And I'm like, almost all the patients have the same disease. Almost all of them have hypertension, diabetes, atherosclerosis, coronary artery disease, cerebral vascular disease, abdominal pressure syndrome. You could easily see 10 patients in a row that have that. Easy. That's how common it is. Okay, so that's what you should be worried about. Prevent that first, and you'll prevent most other things. Yes, there are other things to be aware of, but I'm just telling you, that's where the energy should be focused. What's the best way to prevent all that? Low-fat, low-sodium, vegan diet, manage your stress, be religious, spend time in the sun, have a sense of purpose, have a social group, you maintain your social connections. Okay, anyways, so we talked about it. If you overtreat hypertension, why do you have a blood pressure? So you can get blood to the top of your brain, your cerebral cortex. Okay, normal blood's like water. You're pumping thin blood to the top of your brain. If you make the blood thick by high-fat diet, sticking the red cells together, you decrease the oxygen delivery to the brain. Okay, if you vasoconstrict the arteries, then you have to pump higher pressure to get blood through there. Okay, so pressure goes up with high-fat diets and high-sodium diets, which is like a processed food diet. Too many animal foods, too much oil. Okay, so anyways, remember this picture, hit the print screen button. We're going to come back to this, and this is essential for understanding how the brain works and why people get sick. So the bottom line is you want to fix everything as much as you can with a healthy diet and lifestyle. All right, so now I'm going to go into more detail. We just went through this little diagram about how diabetes and hypertension decrease oxygen delivery to the neurons, your brain cells. All right, now I'm going to talk about the famous Jack Delatorre. Jack Delatorre was a PhD guy from Texas, and he tied off the internal carotid artery in a mouse, and once he did that, middle-aged and older mice, 2 months later, would be demented. He first did an autopsy on the mouse, and he expected to see a big stroke where he tied off the carotid artery on the same side of the brain, but there was no stroke. The brain had simply shrunken, retracted. It was atrophic. And the reason is chronic underperfusion, a chronic lack of blood supply. The neurons can't get enough oxygen and glucose delivery, and they progressively start to die. And the more of them die, the more the brain shrinks. And I can tell you, when I look at demented brains, I looked at, I don't know how many demented brains, 50,000 of them, tons and tons of demented brains. That's the most common thing I see, a shrunken atrophic brain. Okay? So, you don't want that to happen. So what's the main cause of that? Hypertension, diabetes, atherosclerosis. But guess what? If you overtreat the hypertension, you drop the blood supply. The amount of blood that gets up to the top of the brain goes down the penetrating arteries. So overtreating hypertension is dangerous. Remember what Dr. McDougall says. He wouldn't treat hypertension unless the systolic was at least 150 or 160 for a prolonged amount of time, sustained, measured at home. Okay, because you get white coat hypertension when you're in the doctor's office because you're a little nervous. Okay, and I'll show you some other papers. Most common reason these old people fall is because they overtreat their hypertension. All right, what else will cause underperfusion of the brain? I call these mouse equivalents of the Jack Delatorre mouse. If you have atrial fibrillation, you're not pumping enough blood to your brain, you're like the mouse, increases your risk of dementia. Congestive heart failure, you're not pumping enough blood, you're like the mouse equivalent. Dementia. Obstructive sleep apnea, you got a hypoxic brain, okay, it's a mouse equivalent. Diabetes, we talked about how that can damage the brain. If you're hypoglycemic at night and you're sleep apneic, the brain's underperfused, you're increasing your risk of dementia. If you overtreat the hypertension, you're like the mouse, don't get enough blood to your brain. This is called the vascular hypothesis of dementia. Carotid stenosis. Not that many people have a severe carotid stenosis. I see some, but not that many. I see tons of this other stuff. Aortic stenosis, aortic regurg, you'll underperfuse your brain. Post-CABG hypotension, coronary artery bypass graft in the operating room. They put them on the pump, and then the next day and next day after that, the anesthesiologists often run their pressure very low because they don't want to bleed at the anastomosis. Well, I don't want the patient to underperfuse their brain and become demented. Severe anemia worsens brain perfusion. I'm going to show you Jack Delatorre's book. It's a great book. It's called Alzheimer's Disease: A Turning Point. Oh, one paper first. Antihypertensive medications and serious fall injuries. When you overtreat hypertension, as so often is done, these old people start falling and then they hit their heads. A lot of them are on anticoagulations too for AFib or for coronary artery stents, and they'll sometimes bleed into their brains. I actually don't see them bleed into their brains that much. Usually by the time they fall, they start having more falls in the year before that they're going to die. And I see this all the time. Same patient getting head CT after head CT, fell hit head, BHT, blunt head trauma. Okay, here's the Alzheimer's Turning Point book by Jack Delatorre. It's a great book. If you're serious about dementia, it's well worth your time to read this book. I've also given a lot of lectures about Jack Del Torre and his work. Okay, that's where we're going to leave it for today. I hope you have found that helpful. And you can see with hypertension, you want to get your act together as fast as you can so that you control it before brain damage occurs.